Hey everyone, and welcome back. When was the last time your doctor truly asked about your stress, your anxiety, or if you've been feeling down? If you're like most people, probably never, or maybe just a quick afterthought. We've been taught to see mental and physical health as totally separate, right? Different doctors, different worlds, but groundbreaking new research is proving what holistic healers have known forever. Your mind and your heart are profoundly, inseparably connected. What goes on in your head directly shapes what happens in your cardiovascular system. And today, we're diving deep into one of the most important health connections you'll ever learn about. Let's look at the compelling evidence that's forcing mainstream medicine to pay attention. Studies consistently show that if you struggle with depression, anxiety, or chronic stress, your risk of heart problems skyrockets. We're not talking a small bump either. Depression can increase your risk of heart disease by 60% or even more. Anxiety disorders are linked to higher risks of heart attacks and strokes. And chronic stress, it's now officially recognized as an independent risk factor for cardiovascular disease, just like smoking or high cholesterol. Even the American Heart Association recently released a huge report highlighting the psychological distress caused by heart attacks and how to recover. This is massive because it means cardiology is finally acknowledging that your mental state isn't just some side note. It's central to understanding heart disease, both as a cause and a consequence. So, how exactly does your mind affect your heart? It's fascinating and multifaceted. Think about the stress response. When you're stressed, whether from work, relationships, or just constant overwhelm, your body floods with stress hormones like cortisol and adrenaline. Your heart races, blood pressure rises, blood vessels constrict. In short bursts, this is good. It helps us react. But for many of us, that stress response never switches off. Your body is constantly bathing in these hormones, and over time, that chronic activation causes serious damage. It fuels inflammation, increases dangerous visceral fat, and makes your heart work harder, promoting plaque buildup that leads to heart attacks. Depression also impacts your heart in multiple ways. People with depression often have higher levels of inflammatory markers. Plus, depression throws your nervous system off balance, keeping your heart in overdrive. And let's be honest, when you're depressed, healthy habits like exercise, good food, and social connection often go out the window, further increasing your risk. Anxiety is similar, with its own specific effects. Frequent fight-or-flight activations mean constant surges of adrenaline, rapid heart rate, and elevated blood pressure, creating immense wear and tear on your heart over time. There's even emerging research linking trauma, like PTSD, to increased cardiovascular risk. Our psychological wounds can create biological vulnerabilities that show up decades later as heart disease. But the connection goes both ways, especially after a heart attack. The psychological impact can be profound. Fear of another attack, anxiety, depression, even PTSD. These aren't just feelings. They actively increase the risk of future cardiac events. This is why addressing mental health after a heart attack isn't a luxury. It's a critical life-saving part of recovery. Cardiac rehab programs that include psychological support show significantly better outcomes. But here's the empowering part. You don't have to wait for a heart attack to act. Prevention is key. If mental factors contribute to heart disease, then addressing them can prevent it. Strategies like meditation, regular exercise, which is amazing for both your mood and your heart therapy, and cultivating strong social connections are powerful cardiac prevention tools. Loneliness, on the other hand, is a serious risk factor for both depression and heart disease. So, for your heart's sake, invest in your relationships. Sleep is another huge one. Poor sleep impacts both mental and heart health. Prioritizing quality sleep is crucial. And if you're dealing with clinical depression or anxiety, please know that seeking treatment isn't just for your mind, it's for your heart too. Effectively treating depression can significantly reduce cardiovascular risk. Techniques like deep breathing, yoga, and mindfulness directly calm your cardiovascular system. They're not just feel-good activities, they're medicine for your heart. Ultimately, your thoughts, emotions, and psychological states are biological. They affect your hormones, your nervous system, your immune system. When we take care of our mental health, we're taking care of our whole health, especially our hearts. If this video changed how you think about the connection between your mind and your heart, please share it with someone who needs to hear this. This information could truly save lives. Hit that like button, subscribe for more holistic health content, and most importantly, take a moment today to check in with yourself. How are you really doing? Your heart is listening. Thanks for watching, and I'll see you in the next video.